Hey, everybody. Thank you so much for watching this video. This series has been incredible. I've learned so much and I hope you have too. This is our third video of three in a series titled Artificial Intelligence, AI, specifically as a whole, but also focused on the field of biology and the field of medicine and healthcare. Now, if you click on this video, you are probably interested in learning about how AI is impacting the field of medicine and healthcare. And I'm telling you, I learned so much and I hope I can share it with you. So once again, if you haven't seen the other two videos, please think about clicking on them because they're very interesting. I've done hours of research just to share with you, and I've learned so much through the process. If you're taking our free note taker and free certificate of completion course, thank you so much for doing so. This is the last video. Finish strong, and I hope you have learned so much through this process as well. Okay, so what are we going to do in this video? What are we going to learn? We're going to take a look at an overview of AI's impact on the field of medicine. We're going to take a look at healthcare, then we're going to look at medicine. Okay, so I'm going to split it up into two main parts, and I'm going to follow along here as well. If you haven't watched my other videos, I always do a quick disclaimer. I am not a professional when it comes to understanding AI. I'm actually not even a frequent user of AI. So some of you are thinking, what makes you qualified to teach about AI? Nothing. I'm just a teacher who loves learning and I wanted to learn. And I'm telling you, I learned so much about how AI is impacting biology and healthcare, and I just want to share it with you. So if this is helpful to you, awesome. Thank you for watching this video. Another quick disclaimer. Last night I was on the phone with one of my best friends who's a physician and he works in a hospital and I asked him about many different things and he kind of shared with me that yeah, for years they've been taking a look at different things, but as you can imagine, the healthcare field is a little bit slower when it comes to all these things that we're talking about. So maybe not everyone, not every physician has used or has experienced what I'm about to talk about in this video, but perhaps in the next few years we can see some developments to really help our practitioners and to really help our doctors and healthcare professionals. Here's another disclaimer. I believe that AI it already has, and it will continue to play some role in all jobs, not just healthcare. I believe that medical school and training is still needed. You cannot just skip it. You can't just be like, oh, I can just chat GPT that. No, you have to learn about anatomy and have to learn about medicine and have to learn about these different cases. And you've got to take years to gather experience because that's really what medicine's all about. All the experience, all the learning, but all of the other physicians who have come before you, you've got to use all that they have researched and seen what works. Last one, I believe that a healthcare professional should still make the final decision. You should never rely on AI to determine the outcome of your treatment or what to do next. You should always lean on multiple experienced professionals in the industry because every person or case is unique. All right, here we go. Here's an overview. In 2025, artificial intelligence has transitioned from an experimental tool that is found in the like this foundation operating system of modern medicine, fundamental shifting healthcare from reactive treatment to proactive treatment. So understanding that AI plays a role at the clinical level in diagnostics and patient triage and chronic disease monitoring, offering high quality, state-of-the-art care accessible even in under-resourced and rural environments. So maybe you don't have access to all of the people like in an urban setting, but AI can definitely help out. As we can take a look at healthcare, let's focus on diagnostics and clinicals. So this is really interesting, and I hope you, and maybe you're interested in healthcare, can learn a lot from watching this video. As we can see that there's achieving accuracy rates that often surpass specialized factors in specific pattern recognition tasks. So let's first talk about imaging precision. So as you can probably imagine, one of the uses of AI right now in the healthcare system is how the AI algorithm for radiology and pathology have absolutely reached a higher accuracy. It's not fully perfect, but pretty high, 94% in detecting conditions like lung nodules or breast cancer compared to the human average of roughly 65 to 78. So we're identifying and diagnosing more clearer with AI. My friend also talked to me about how he's a part of a study right now and the use of AI when it comes to um, GI doctors, right? Gastrointestinal doctors and how they do routine endoscopies and also colonoscopies. As you can see here, actually, no, sorry, the GI doc will focus on colonoscopies. This image I pulled up is an endoscopy, but it's very similar to a colonoscopy when it comes to what I'm about to talk about, the AI research. So as you can see, this is on the left, a typical endoscopy visual where a camera will go down. There's an anesthesiologist who will put the patient to sleep, and then the camera will take a look at if there's any polyps or if there's any abnormalities when it comes to the intestinal tract, or in this case, the and the and your eating tract. Okay, so what is this? So these green boxes are AI guesses on where polyps are or abnormalities. Now, are they always right? No, but at least they offer some technology to these doctors in case they miss something or in case um, it just gives you just the idea of the AI identifying these different abnormalities. Early detection, which is huge in healthcare. Systems can now spot pre-symptomatic signs of heart disease or neurological conditions like Alzheimer's years before a patient feels that. Even EKGs, and we'll talk about that in a bit, but in the past, doctors have even counted EKGs on their own, but now you just plug into an algorithm and the EKGs can immediately be given in a numerical sense to the doctor. So that's huge. Real-time triage. We take a look at in ERs, AI tools like Viz.ai or AI Doc. I've never played with these, so you can look these up if you'd like. Automatically scan CT images the second they're taken, alerting surgeons of strokes or brain hemorrhages in minutes, cutting down treatment plans to over an hour. So now let's look at care and delivery, the bedside manner. So this I've actually seen in different doctors' offices, or have heard of it when it comes to family and friends who have gone to doctors. To reduce the clerical burden on doctors, a lot of times the doctor is trying to type as you're talking. Why? They're trying to scribe. They're trying to put in information in case they can look back on your case. But there's tools now, and I haven't exactly used these, but I've heard of them. Dragon Copilot or Suki AI. So really what it is the doctor will ask you if you feel comfortable having your conversation recorded. And if your conversation is recorded, then you'll see kind of this voice memo button happen as you talk. And really what they're doing is they're capturing your entire um, conversation. And then it automatically generates a medical note. It's kind of like a free scribe because previously you'd pay for a scribe to write down as the doctor diagnoses and talks to the patient. But in 2025, this is reduced, apparently, reduced physician paperwork time and even burnout. Okay, so this is maybe gonna, yeah, most likely gonna come about more and more in the next few years. You look at agentic medical assistants, we have entered an era of agentic autonomous software agents like patient intake, look at lab results for immediate review. You can even look at personalized treatment plans. In oncology, AI analyzes a tumor's genetic profile to recommend a specific chemotherapy or immunotherapy. That being said, as I said earlier, the doctor should always make the final decision. You should never just rely on this because every case and every patient is different. So keep that in mind. Now let's look at medicine. This is really interesting. So we looked at healthcare. Now let's look at medicine, the personalized and precision when it comes to medicine. So AI will really act as a second set of eyes for doctors, spotting patterns that are too subtle for the human eye or ear. Now, as I said earlier, EKGs, the technology on EKGs has definitely improved because now we can analyze EKGs fast within seconds versus it would take a lot longer before technology and AI. And this has happened for years. This is not anything new, but it's definitely a technology that is very notable. Early detection via EKGs. Researchers have developed now AI that can diagnose complex heart conditions like coronary microvascular dysfunction using just a 10-second EKG strip. So the University of Michigan was the one that it was a group that created this, and this is pretty new. And we always want to avoid invasive surgery, and this is going to be helpful in that. There's digital biomarkers. So when you analyze chest X-rays or even a patient's voice, you can take a look, you can estimate a patient's biological age, identifying those of high risk, age mortality, etc. So here's a lot of the other digital biomarkers that you could collect to analyze. You can look at oncology cancer care. AI now analyzes tumor-specific genetic signatures, which is the immunotherapy or chemotherapy. It's about a 93% match, which is incredibly accurate. However, I always like to say this, you cannot rely on AI to diagnose and or to give a treatment plan. You should always rely on an experienced professional when it comes to medicine. Here we have pharmacogenomics, AI predicting how your body will metabolize certain medications. I thought this was really interesting, preventing a trial and error or finding the right antidepressant or blood pressure medication, etc. We can also have continuous monitoring. You've seen wearable technology, and this is AI. This is watches and rings, and this has been out for years, detecting irregular heartbeats, even predicting infections earlier before a patient even feels anything or a fever. When we look at drug discovery and design, we learned about, I have not looked at it, but the de novo chemistry. Once again, I've talked about Pharma.AI. You can look that up if you like, if you're interested in learning more. Instead of searching for drugs in nature, generative AI now designs new molecules from scratch to perfectly fit a specific disease-causing protein, like a key into a lock. The death of trial and error. So there's a lot of trial and error that happens in medicine, and it should, because we want to make sure we give people the best possible medicine. But by 2025, it's estimated about 30% of new drugs are discovered using AI. This has reduced time to bring a drug to clinical trials from 5 years to about less than 2 years. So it's sped that up. And hopefully that's super accurate and good to go. Digital twins. Scientists are using AI to create digital twins of patients to simulate how they're going to respond to a drug before they take it. Now, who actually knows what's actually going to happen? When a person takes drugs, a lot of different things can happen. But this definitely helps ease some tension when it comes to delivering medicine well. Thank you for watching. And wow, there's so much more, but I hope you can have learned something. Here's some reflection questions. What did you learn? What do you remember from this lesson on AI in medicine and healthcare? Reflect. What is the use of AI in biology that surprised you or in medicine? What have you seen in AI impact medicine and healthcare? Maybe I didn't mention it. Maybe you can share with me and you can teach me. 10 years from now, or even a few years from now, it's going to change. How do you think it's going to impact the field of medicine? Who knows? And we'll learn as things start coming out and write down one question that you have. And remember, you learn most by when you do the research. And that's how I learn so much. So thank you for watching. I love doing this every year. I hope to see you next year as we study something new together. All right. Have a good one. Bye bye.